I don't know what's wrong with this thing.
Governor Murphy, when you're ready.
Thank you, Michelle. Good afternoon, everybody. Today is I think, a truly great day for New Jersey families. So from the very beginning, our administration set out to build, you've heard us say so often, the stronger and fairer New Jersey that works not just for some, but for everybody. And that meant examining cold-bloodedly, starkly, our greatest challenges in depth and from every possible angle, and creating comprehensive, groundbreaking solutions to those challenges. In other words, looking in the mirror, looking at exactly what we see, and then developing a plan to figure out how to get better. I am incredibly proud that the Adverse Childhood Experiences Action Plan has been created through that very way of thinking. I want to commend a couple of folks who are with us today, beginning with Commissioner Christine Norbert. Christine, hats off to you and your team. Executive Director, Dave Ellis. Dave, again, hats off. The New Jersey ACES Collaborative, the ACES interagency team, and all those who worked for years to bring this plan to fruition. In addition to Christine and Dave, I'm incredibly honored to have my partner in government, the singular Lieutenant Governor Sheila Oliver, and if that weren't enough, First Lady of the great state of New Jersey, Tammy Murphy. And you'll hear from Christine, Dave, Sheila, and Tammy. Childhood trauma happens across such a wide spectrum of experiences that no one person, no nonprofit, or no government agency or organization can address it on their own. We need to be proactive as we contend with effects of ACEs, the mental and physical effects of the COVID-19 pandemic, as if it weren't enough already, and as we work hard to break the cycle of trauma that has resulted from centuries of systemic racism and discrimination. This interagency statewide plan is integral to tackling childhood trauma before it manifests into negative health outcomes. And I'm especially hopeful for New Jersey's mothers and babies as this plan supports the newly released Nurture NJ Maternal and Infant Health Strategic Plan. I'm deeply grateful. I know Sheila and the rest of us join me in this respect, to all the organizations and agencies that have contributed and partnered to work on this issue. And I know that we could not reach families in need without your support and commitment. I use a lot of baseball analogies, forgive me. Even if we batted 1,000, no entity, including government, can do what this plan envisions on its own. The NJ ACES Action Plan serves as a blueprint for action to make New Jersey a leader in tackling adverse childhood experiences. It seeks to empower New Jerseyans and our communities to equip not some, but everyone with the tools to support resiliency and to ultimately prevent adverse childhood experiences from impacting our families. Only by working together will we stop the cycle of abuse and toxic stress and ensure a healthy, safe life for every New Jersey mom, dad, baby, child, and family. With that, I want to introduce an incredible partner in this mission, an advocate for New Jersey families. As I say, I have the honor to call her my partner in government, the one, the only Lieutenant Governor Sheila Oliver.
Thank you, Governor Murphy. And the one accolade you cannot give me is learning how to use a ring light and all these other things. And when I always think I've got it under control, I don't. But thank you, Governor Murphy. Good morning, everyone. I'm very happy to join with Governor Murphy and First Lady Tammy Murphy and, of course, Commissioner Beyer and Mr. Ellis. I remember when the first ACE initiative was undertaken, and many of the collaborating nonprofits and government units began to talk about, you know, we try to do a lot for children. We try to make certain that they are safe. We want to make certain that they have an education and they have all the basics to have a positive childhood. But there is no doubt we have significant numbers of children in our state who are traumatized by adverse childhood experiences. And these are experiences that if there is no intervention, children will grow into adulthood carrying that baggage which no one has ever addressed for them. I remember going to the General Assembly, serving on the Human Services Committee, and I would hear testimony from a wide range of families and young people about issues they were grappling with. And that's what led me to support creating a bill to create the Children and Families Department and get away from the nomenclature DIFUS, which had such a negative tone and a stigma. But I think that ACE is definitely where we need to be. Mental health and mental health amongst children is extremely important. As the report points out, we've got children who, are living within dysfunctional family units. We've got children whose families are moving 4 and 5 and 6 times a year because there's no stable housing within the household. I won't even begin to talk about the children of incarcerated parents. That is a space that we need to function and put attention on. So I'm happy, Tammy, that you've worked with the commissioner and the governor and Dave to, really have New Jersey become a leader in addressing adverse childhood experiences.
Sheila, thank you. Go back to your first comment. You can sign me up for the same challenges that you expressed earlier. Amen, Sheila. And I mentioned this, and we all know this, and to your comments, a year ago, this was already a challenge. And then you add on top of that a pandemic, the national moment as it relates to racial justice, the economic fallout from the pandemic. It has, all of that has taken what was already a stark and challenging reality as it relates to adverse childhood experiences and made it even starker and more challenging. I mentioned, Sheila, thank you for everything. I mentioned in my remarks the maternal and infant challenges and mortality rate explicitly, and furthermore explicitly among moms and babies of color that is part of the Nurture NJ plan. The notion is espoused by the First Lady and so many others in government and stakeholders to get New Jersey to be the safest place to both deliver a child and to raise a child. And that's not the only angle for the First Lady, but that's certainly an important one as it relates to today's discussion. So with that, please help me with someone I know rather well, the First Lady of the great state of New Jersey, Tammy Murphy.
Good afternoon, everyone. Wow, as though it is not bad enough to follow Phil, I then get the honor of following yet another hard act, our Lieutenant Governor. But needless to say, I am so grateful to have her as our partner and ally and leader in our work to support all of New Jersey's families. And of course, I would like to recognize Commissioner Christine Norbert Beyer, as well as Dave Ellis at the Office of Resilience for leading this incredible initiative. I'm proud that my office was able to serve on the New Jersey ACE's interagency team of public and private sector leaders. Speaking of our work, I would be remiss if I did not acknowledge the members of the NJ Funders ACES Collaborative, the Nicholson Foundation, the Terrell Fund, and the Burke Foundation. Through this action plan, our incredible team of competent and passionate advocates will effect change that will ripple through the lives of New Jersey families for generations to come. An adult who has experienced trauma in childhood is less likely to have learned healthy behaviors to cope with stress. They are at a greater risk for certain chronic health conditions. They may engage in risky behavior. And ultimately, this cycle is likely to repeat itself when they become parents themselves. Also troubling are the racial disparities in exposure to adversity. 15% of young children of color are exposed to multiple adversities before the age of 5, more than twice the rate of young white children. These disparities are due to a cycle of trauma that has resulted from the centuries of systemic racism and discrimination. But now New Jersey has a plan to break the cycle of trauma and support children and adults who have experienced these ACEs. This is really life-changing work. And as you may know, in our work through Nurture NJ, we recently released our plan to make New Jersey the safest, most equitable place in the nation to deliver and raise a baby. And you can be certain that it includes trauma-informed care and the implementation of today's NJACE's action plan. These are efforts that are inextricably linked. Healthy girls, both mentally and physically, grow to become healthy pregnant women and ultimately healthy mothers. ACEs-related health effects can impact pregnancy and result in newborns with reduced birth weight, shorter gestational age, and higher risks of developmental challenges and socio-emotional problems. If we fixate exclusively on the 9 months of pregnancy to prioritize a woman's health, we've missed the mark and put another entire generation at risk. But if we can help a little girl or a little boy heal from trauma today, then we're helping them become better mothers and fathers tomorrow. If we can help young adult men and women cope with the trauma of their childhood, we've stopped the cycle of toxic stress in its tracks. And together, we are working to make that a reality for every New Jersey family. Thanks so much for having me.
Well said, Tammy. And thank you for everything you and your office do for these issues and these families and these kids. Bless you. So I take my hat off to the next speaker as well. I know Sheila and Tammy join me in that respect. The Department of Children and Families is not surprisingly not just at the table on something like this, but the table setter. And I don't think there's a better example of that process I mentioned earlier of staring cold-bloodedly in the mirror, looking at the honest truths, and then saying, you know what, we have to acknowledge this is what exists. In this case, adverse childhood experiences. Now let's put a plan together and do something about that. And that begins with leadership. It's my honor to introduce another extraordinary colleague, the Commissioner of the Department of Children and Families, Christine Norbert. Christine?
Thank you. Good afternoon, everyone. Thank you, Governor, Lieutenant Governor, and First Lady Murphy and Dave. I'm so pleased to have you here today, you know, as we release this blueprint for change, transforming New Jersey into a trauma-informed and healing-centered state, and advancing our work as a statewide system to address childhood adversity. In child and family serving systems, we've known for decades about the lifelong impact of adverse childhood experiences, or ACEs, and how high rates of adversity in childhood can lead to social, emotional, economic, and health challenges into adulthood. So thanks to a team of research scientists co-led by Dr. Robert Anda, who's actually on today's Zoom call with us, who identified ACEs and their effects on adults in a foundational, groundbreaking study for the CDC and Kaiser Permanente back in the 1990s. We know that adversity can reshape a developing brain, literally transforming the architecture of neurons and neurotransmitters. We know that adversity can seep into a family's DNA, being passed down from generation to generation like some unwanted inheritance of toxic stress and trauma. We know that adversity is seen and felt across the entire socioeconomic spectrum. It's not based on geography or where you grew up, farm or city or suburb. It's not based on the color of your skin or any one culture or ethnicity. And it's not dependent on wealth or poverty. We all experience ACEs. We also know that systemic barriers, economic disenfranchisement, and institutionalized racism can and do contribute to the increased likelihood for adversity in children and youth throughout New Jersey. We know that as we continue to deal with a once-in-a-century public health crisis, that social isolation is exacerbating stress, anxiety, and mental health challenges among New Jerseyans of all ages. Amongst my colleagues, we're already discussing how the COVID-19 pandemic is an adverse childhood event all on its own, and families and public systems will be dealing with the after effects of the pandemic for many years. But despite the challenges laid out before us, today is really a day of hope. Today, we're kicking off a comprehensive, forward-thinking plan to put New Jersey at the forefront of states in addressing and preventing ACEs. Over the course of several years, the New Jersey ACEs Collaborative, made up of the Burke Foundation, the Nicholson Foundation, the Terrell Fund, and New Jersey's Department of Children and Families has been working and then working in support with support from the Center for Healthcare Strategies. We developed this action plan intended to disrupt the negative impact of ACEs and heal New Jersey residents from the effects of toxic stress and trauma. The action plan would facilitate greater cooperation amongst agencies and stakeholders, recognizing that there are individual efforts already underway across multiple disciplines in New Jersey to address ACEs, including law enforcement, education, public health, and child welfare, but that we're all stronger together. It creates the impetus and mechanism for an all of state government approach to this work, because the effects of ACEs on healthcare systems, on the state economy, on child protection, it affects all of us. The plan advocates for community voice and community leadership, utilizing a boots on the ground approach to propel New Jersey forward and engaging individuals with lived experience as partners in this work. This action plan creates a public awareness campaign and a training structure to educate New Jersey's residents on ACEs and the resources available to heal and build resilience. And it promotes a vibrant virtual learning community to allow people to come together, share their thoughts and ideas, and connect with like-minded people who are committed to the work. From the research, we know that ACEs increase the likelihood for negative outcomes in adulthood, but that's not guaranteed. We know that positive relationships, therapeutic interventions, and affirming experiences can help us heal and can mean the difference between overcoming adversity or being overcome by it. Sometimes just one caring, nurturing, and safe relationship with an adult can be all a child needs to build up their stores of resilience and mitigate the long-term effects of ACEs. So today, we're asking New Jersey residents to be that safe relationship for a child in need. Join us in our work, learn more about ACEs, and sign up to connect to our virtual learning community at acesconnection.com. I'd like to thank the Governor, Lieutenant Governor, and First Lady for their ongoing partnership and support in making New Jersey a national leader in the fight against childhood adversity. And I'd also like to thank our partners in the New Jersey ACEs collaboration, the Burke Foundation, Nicholson Foundation, and the Terrell Fund for their collaboration and partnership and significant resources of time and financial support that created the Office of Resilience and the development of this action plan. This is a public-private partnership at its best. And finally, I'd like to recognize and thank my colleague, Dave Ellis, who leads the Office of Resilience and will be instrumental in leading our state's response to ACEs. So to be clear, we know what's at stake if we do nothing to address ACEs in New Jersey. We're approaching this work with eyes wide open and hearts filled with hope that we can mitigate ACEs for thousands of children around New Jersey. So we know what's being asked of us in this moment. So now it's time to get to work. Thank you all.
Christine, really well done. Congratulations. And listen, we recognize this is a plan. It's a great example, as you say, of public-private partnership. We're on a journey. We know where we need to go. We're not there yet for sure, but boy, it feels good to know what that map looks like and the journey, what that journey looks like. Thank you. We are really lucky in New Jersey to have Dave Ellis. Dave is a Minnesotan. He's a Gopher. Likes the cold weather. But I believe, Dave, you were headed points southwest, and New Jersey interrupted that journey. And we're incredibly blessed to have you on our team. Please help me welcome Dave Ellis, who is the Executive Director of the Office of Resilience within the Department of Children and Families. Dave, take it away.
Thank you, sir. And yes, I was on my way to the Southwest, and somebody was awfully persuasive. And so I did end up here. First of all, let me just say thank you to you, Governor Murphy, Lieutenant Governor Oliver, First Lady Tammy Murphy. I'm honored to be here today and incredibly excited about today's ACEs Action Plan launch. I've been in New Jersey less than a year, but I've been so welcomed And I guess I should say we've been so welcomed, because my wife is here with me, by everyone who's involved in this work. And realistically, it's because of the groundwork that you guys laid. There's been a lot of work happening already. And so it was pretty easy for me to come in and make a lot of friends. And you're socially advanced in the thinking that you're doing here in this state. And it's a true testament to leadership, to your leadership. I've been doing this ACEs work for my whole life. It wasn't until I heard about the study from one of the co-principal investigators, Dr. Vincent Folletti, that I realized for the first time that I wasn't crazy. It was hearing about things that happened to me that shaped me into being who I am today, shaped me in a way that didn't bring shame and blame into the conversation that allows me to do this work. It was almost a year ago that I started the interview process. I believe it was actually maybe a year now. I think we started in February to fill this position of executive on loan. I accepted the position in May of 2020. My wife and I sold our family house of 40 years and moved here. We've been here in Somerset for all of 7 months. I say that so you know that I didn't do this work by myself. You did this work with the support, first of all, from the community. And I have to say thank you to them for stepping in and stepping up, but also from folks at the Burke Foundation, the Nicholson Foundation, the Terrell Fund, and of course, Commissioner Beyer and DCF. A special thanks to all of you. You have been incredible supporters and advocates for preventing and mitigating and eliminating ACEs. This action plan reflects years of work that's been going on throughout the state, informed by best practices, research, and the voices of people directly impacted by adverse childhood experiences. A full 2 years in the making, it represents the perspectives of many stakeholders across the state, from individuals and families to policymakers, doctors, teachers, and more. It lays out a path of hard work, but it also lays out a path of heart work that's consent-based and readiness-driven. We are more than our collective traumas. We are our potential for resilience and our capacity for strength. The need to mitigate the impacts of ACEs is especially salient, given the collective exposure to racial injustice, the social unrest that we've seen lately, and as my granddaughter Callie says, the corona. She couldn't say that other word, but she could say corona. So we go with that. Learning about oneself can be a great awakening and truly a catalyst for courage, compassion, and clarity. I look forward to raising awareness and shepherding New Jersey on a course towards becoming trauma-informed and healing-centered. Every day, as public servants, we ask people to share their needs, but not their stories. I used to talk about meeting people where they're at. In reality, I want to meet people where they dream. We must hear their stories. It's in this space, between the stories and the dreams, that we share our humanity, concern, and care for each other. The late John Lennon wrote a song called Imagine. Imagination is about dreaming. We're talking about shifting a culture here, and that's going to take time. We've spent lifetimes doing the things the way that we have, sometimes to our own disadvantage. Preventing ACEs means changing lives, literally changing the trajectory of generational adversity into people's personal best. Governor, I am a fan of quotes, and this one seemed absolutely appropriate. It says, as we focus on cleaning our generational trauma, do not forget to claim your generational strengths. Your ancestors gave you more than just wounds. And that is a quote from Xavier Dagba. And these are just things that I love to do because they help me figure out really how do I do this work. The late Cicely Tyson said, "I am a dreamer of audacious dreams." Realistically, now is the time for us as New Jerseyans to dream audacious dreams and to take bold action. Join us in making this dream come true. Thank you, Governor Murphy, Lieutenant Governor Oliver, First Lady Tammy Murphy, and of course, Commissioner Byer.
Boy, am I glad you're the last speaker, Dave, because none of us could have followed that. Bless you, bless you, bless you. What an incredible honor that you've chosen to put New Jersey on your life journey. There was one question in the chat room, and then I had a question, just a quickie, and I don't want to take up too much of your time. These are either for Dave or Christine. Someone asked, is the report going to be public? I assume the answer is yes, and maybe could someone, Dave or Christine, could you tell the folks who are watching how they can access that?
Commissioner.
Yeah, the report is public. It will be available immediately following this press conference, and it can be found on the DCF website. So if you go to dcf.nj.gov, you'll be able to access it.
Thank you for that. And then I guess secondly, and Dave, you've got a perspective on this because you haven't called New Jersey home for your entire life. But where, and I know, as I said earlier, this is a plan, right? So we're on a journey. We just got the map of where that journey, what that's going to look like, where it's going to take, what we're all going to have to do. Where does this place New Jersey among American states?
You know, I would like to believe that it puts us at the front of the list. I know there's a lot of work going on. I talk with my national folks all the time. They've been waiting for this plan as much as we have. They want to see, first of all, there's been questions about this position and how it even got created. So that piece is of interest to people across the country because there's nothing else like this. But the plan itself, being basically designed by community, is not something that's happened. And so in my head, this puts us in a position to continue moving forward and also to address the issue of sustainability, because that's where the sustainability is.
There are our time is coming to an end. There were some other questions, Dave and Christine, that came up. You may want to circle back with the folks. Budget question, how can libraries partner in this endeavor? All good questions. I just want to say we're constantly also looking in the mirror and asking ourselves, what does New Jersey look like for the family that's here, or the prospective family that's here, or a family looking at where to plant their flag and raise their kids? As Tammy and I were, by the way. Neither of us are originally from New Jersey, but for a lot of reasons, we chose to raise our 4 kids in New Jersey, the best decision we ever made. I'd like to think that our honest approach, our collaborative approach, our comprehensive approach to adverse childhood experiences is yet another reason to either stay here or to come here. With that, I want to thank, as always, my partner in government, the one and only Lieutenant Governor Sheila Oliver, First Lady Tammy Murphy, Commissioner Christine Norbert Byer, and again, Dave Ellis. We are incredibly honored that you have put New Jersey on your life journey, and we thank each and every one of you and your teams. And by the way, to all the stakeholders who are watching this discussion, who were so instrumental in this, bless you and thank you on behalf of all of us. Take care, folks.
Thank you, Governor.
Bye. Thank you.